is about the lesser sac. So first we will see what is meant by the lesser sac. So lesser sac is also called as the omental bursa. Okay, so lesser sac is nothing but it is a part of the peritoneal cavity which is located behind the stomach and the lesser omentum. First we have to know the difference between the lesser sac and the lesser omentum. So coming to the lesser omentum, it is the fold of the peritoneal cavity, whereas the lesser sac is a part of the peritoneal cavity. In the sense, the lesser sac is also the cavity which is presented in the peritoneal cavity, whereas lesser omentum is the peritoneal fold in the peritoneal cavity. Okay, this is the major difference between the lesser sac and the lesser omentum. Okay, so in this video we are going to see about the lesser sac. Okay, so lesser sac is the part of the peritoneal cavity which is located behind the stomach. Okay, so it is the potential space in the peritoneal cavity which allows the movement of the stomach and the surrounding organs. So normally the movements of the organ taking place due to the inspiration and expiration activities. So stomach also moves in this particular space. So this space allows the movement of the stomach and the surrounding organs. So coming to the boundaries of the lesser sac. Okay, anteriorly we have anterior to the lesser sac. I said this lesser sac is presented behind the stomach. So for the lesser sac, the stomach is presented anteriorly. So stomach, normally the lesser curvature of stomach is related to the lesser omentum. Okay, so the anterior relations of the lesser sac is the stomach, lesser omentum. That to stomach, posterior surface of the stomach is related to the lesser sac, and lesser omentum is also related anteriorly to the lesser sac. Okay, and coming to the posterior relations, posterior to the lesser sac, pancreas, left kidney and left adrenal gland and transverse mesocolon is all presented posteriorly. Okay, superiorly, liver, that too caudate lobe and diaphragm is presented superiorly. So coming to inferiorly, transverse mesocolon and its transverse colon is presented. Coming to the right side, so right side, the epibloic foramen is presented. Epibloic foramen is presented. The epibloic foramen is nothing, is the foramen is also called as foramen of Winslow. So this lesser sac, right side is related to this foramen. So through this foramen, the lesser sac just gets contact with the greater sac. So lesser sac and greater sacs are connected through the foramen of Winslow or epibloic foramen. So this is presented on the right side of the lesser sac. Coming to the left side, normally in left side what organ is presented to the stomach? Spleen is presented. So the ligament which is related to the spleen is also presented. Gastrosplenic, splenorenal ligaments. Okay, this is the left side. So coming to the function of the lesser sac, as I said, it allows the free movement. Okay, and it provides the space for fluid accumulation. So so in upcoming slides I will be saying you about the pancreatitis. What about the peritonitis? As the name ends in the TIS, it indicates the inflammation. So inflammation in the peritoneal cavity is referred as the peritonitis. So during this infection, a fluid may accumulate in this space, in this lesser sac. Okay, and surgical significance. So some surgical procedure which is related to the stomach, pancreas and duodenum, this space is more important because the space is surrounded by these organs. Okay, So you can able to appreciate the stomach flexor curvature. This is the liver. So this is the lesser omentum normally, but behind it what is presented? Lesser sac is presented. In this picture you can able to see it clearly. So the anterior relations are the, here we have the lesser sac, posterior surface of the stomach, and first two layers of the greater sac. These are the anterior relations. Coming to the posterior relations, what we saw, last two layers of the greater omentum, transverse mesocolon, duodenum. So all these are the posterior relations. You can able to differentiate it here. Okay. So this is the lesser sac. So this lesser sac, anterior relations, posterior relations, you can able to see in this picture. Okay. So coming to the clinical significance, first is the pancreatic pseudocytes. During the pancreatitis, some of the fluid may accumulate in the lesser sac. So during pancreatitis, fluid may accumulate in the lesser sac, which is referred as pseudocytes, because normally the cyst will be formed in the lesser sac, which is normally cyst will be formed in the space which is related to that particular area, but here the cyst formed in the lesser sac, but the reason behind is the pancreatitis. So the cyst should be formed in the pancreas, but here it is formed in the lesser sac, so that it is referred as the pseudocyst. Okay. So you can able to see here the pseudocyst. Okay. So coming to the perforated gastric ulcer. So gastric ulcer in the sense the lining of the stomach gets affected due to some of the infections or due to the hypersecretion of the HCl, so that the lining of the stomach get affected and leads to the gastric ulcer. But what is my perforated gastric ulcer? The whole thickening of the stomach. See, the whole thickening of the stomach layer, it gets affected and it becomes a hole like substance. Full thickness of the stomach gets affected. That is referred as the perforated gastric ulcers. So this is known as perforated gastric ulcer. So during this, as you know that the lesser sac is presented just behind the stomach, so lesser sac. So when this perforation is taking place, the acidic content may enter into the lesser sac and gets affected. Normally the acidic content should be within the stomach. When it leaks out, it enters into the lesser sac and leads to the complications. That is known as the perforated gastric ulcer. Okay. So these are about the lesser sac. Thank you.